So, before we continue, let's take a second to metabolize everything that has been said in the first module. By now, you've seen that resistance is not an obstacle to therapy. It is therapy. It is not a mistake in the process, but the process itself. Whether it shows up as silence, compliance, anger, perfectionism, or even a smile, resistance always points us directly to the client's inner architecture. Resistance is always present. The question is whether you can see it, and how you relate to it will determine the direction of therapy. Meeting resistance with curiosity, patience, and respect is essential. From Freud's early observations of repression to Reich's insight that resistance is woven into the very structure of personality, the lesson is the same. Resistance is not a side issue. It is the heart of the work. Personality itself is structured around resistance between parts. Engaging with it brings us directly to the core of the problem. That is why resistance is not just an obstacle, but one of the most important elements of psychotherapy. The way resistance is structured inside the client is likely the same way they will resist you and the therapy process. Since the personality structure was in place long before therapy began, it is unlikely that the client will show up in any way outside of it. The same defenses that once ensured survival will inevitably shape how they meet you, how they relate to the process, and how resistance unfolds in the room. Resistance is survival strategy. What looks like defensiveness is actually the client's way of surviving, anchored either in protectors, in exiles, or in constant switching between the two. No part is disposable. Even destructive protectors once served and still serve an important function. The obstacle is not the part itself, but our failure to understand its role. That's why it's essential to work symmetrically. Instead of standing against the client in an asymmetric stance, labeling them as resistant, the therapist stands alongside, meeting resistance with curiosity, patience, and respect. The MAP lens, with its focus on identity foundations and boundaries, helps clarify how identity is anchored and how it relates to resistance. In practice, this means noticing whether the client's identity is rooted in a protector, an exile, or in the switching between the two. From this perspective, resistance shows up as a threat to the sense of self, not just as a defensive structure for survival and adaptation. Reich's principle remains crucial. If you don't take care of the resistance, resistance will take care of you. This doesn't mean that interventions can never be directed toward the wounded parts. But as a general guideline, resistance must be addressed first. Ignoring it leads therapy into countless problems that could otherwise be avoided or minimized. Your task is not to bypass or fight resistance, but to enter into it, reveal its logic, and work with it. So pause here and ask yourself, how does this perspective shift your understanding of a client's experience? Would you still try to fight, minimize, or expel a part of the psyche? How might this influence your therapeutic stance? What would you change, and what would remain the same? If resistance is part of every session, how does that change what progress looks like? What becomes possible in therapy if resistance is not an obstacle, but the doorway? This is the foundation. Everything that follows builds upon it. Up to this point, we focused mostly on how resistance arises within the client. However, as you've seen, how you approach it is just as significant as the client side of the story. This is where the symmetric approach becomes crucial. Instead of viewing resistance as the client's problem, You begin to see it as a co-created dynamic. And as you'll see soon, some authors even claim that it's not the client who is responsible for the resistance, it's you who creates it. And that's the good news, because you can't change the client, but you can change how you approach them. Now, let's take a look at your side of the symmetry.